Medicine doesn't have to be confusing. Welcome to Dr. Ati classes. Here you find clear explanation. Let's master medicine together. In this post, I want to give you a complete 0 to 100 learning challenge on anaphylactic shock. First, let me tell you in under 10 seconds what anaphylaxis is. It means Dr. Ati has reached to a medication or a food and has entered a series of dangerous, potentially fatal stages. First, we can see the red erythrocolor rashes on her hands and on her cheeks, and the trunk to remind you that hives can appear on the body and are one of the signs of anaphylaxis. We also can see the swelling of the lips here, which show us the angioedema to show you that the edema of the lips, mucosa, tongue, and larynx can lead to shortness of breath, airway obstructions, and death if it's not treated promptly. We can also see that the swelling on the neck of Dr. Ati, which indicate the laryngeal edema, which can also cause the suffocation and death in anaphylaxis. As the name suggests, anaphylactic shock, the patient develop hypotension. On the monitor here, we can see the blood pressure of 80/50. One of the major causes of mortality in anaphylaxis is respiratory distress. That's why we place an oxygen mask here and oxygen cylinder next to the bed to remind you that the oxygen therapy is part of the initial management of anaphylaxis. On the right side of the Dr. Ati, we can see that the bag hang, which is the IV fluid bag, to emphasize that when blood pressure drops, the fluid resuscitation is needed. Now we're coming to the most important part, which is the medication. We have placed 3 medications on the table. First, on the left side is the epinephrine, the most important drug in the treatment of anaphylaxis. You should administer 0.5 milligram to your patient, and it can be repeated every 5 minutes for up to 3 doses. You may also use corticosteroids such as hydrocortisone between 100 to 200 milligram. And finally is the aminophylline, which can be used to help open the patient's airway. That was all for today. Save the video, share it, and stay one step ahead in medication. See you in the next video.